I am Amber Donnelly, the chair of the CPRC, and I'm glad to see so many of you. And actually, a lot of the names I don't recognize, which is unusual. So I'm glad that you could join us today. We will be doing just some short updates from the CPRC, so the Cytotechnology Programs Review Committee, who reports to KHEP on accreditation issues. And we'll also be hearing about the C.E.L.L. from Sean McNair, which will be an important resource for programs moving forward to the masters. So with that, I'll go ahead and share my screen. All right, everyone see my PowerPoint?
Yes.
All right, thank you.
Yes.
All right, so I just want to start by saying thanks to all the members of the CPRC. It's a very hardworking group. We have a lot to do and a lot to get accomplished in the year. And so I just want to say thank you to those who are, members of the committee. So you'll see those there, and then another page here. So we have quite a few members. And this is my last year as chair, and then Dr. Sturgis will take over. He is co-chair this year. So just a little bit about our programs in the United States. So for the current school year, we have 19 active programs. And actually, we do have one inactive program. So I'm not sure this slide was kind of reused from a different presentation, but we do have one inactive program. We don't have any new starting programs, but we do have 11 satellite sites with the University of Nebraska, and then also we have 4 Anytime, Anywhere sites. 10 of the satellite sites have students this year. 1 of the sites does not. This is just a nice little visual to kind of show you where our programs are. So our accredited programs are in red, satellite programs in kind of a yellow, and Anytime, Anywhere in purple. So you can kind of see that we have the majority of schools toward the east, just a few on the west, and kind of nothing in between. For our programs, they can offer anything from a post-baccalaureate certificate, a bachelor's degree, or a master's degree, or a combination thereof. So you can see 9 programs offer certificate only, 9 offer degree only, 1 offers a certificate and a degree, and 5 of those degree programs are at the master's level, which is 26% of our total programs. We do have a few that are changing to a master's degree. We may have a few more that are in the works but haven't notified the CPRC yet. But the University of Nebraska will be switching as of August of 2022. And the University of Arkansas is planning for their transition in 2023. This just shows the capacity of the programs. So over the years, you'll have seen that we never fill all the seats that we have. So about 40% of the seats in our programs remain open. So I guess, one of the charges of the CPRC should be trying to figure out how to promote the profession and ways that we can enhance recruitment. And I think that our sponsoring organizations can kind of help us through that as well, because I think it's gotten better over the years, because now we have a lot of job openings at the current time. And so I think more incoming students hear about those job opportunities and are applying to our programs. However, we still do have 40% of our seats open. So this is just some of the outcomes data that each year the programs have to submit an annual report. And you'll see that this is for the 3-year term from 2018 to 2020. And we've had good outcomes. We've met all of the thresholds. And so I think that our programs are doing well. Probably one of the lowest is this employer survey return rate. And we all know as educators that sometimes it can be very difficult to get those returned, but we try really hard to do the best we can do. And the threshold is only 50%. So we've met that one as well. We do have a positive placement rate, and positive placement rate means that they're employed in cytology or a profession that's similar, in pathology or something related to cytology. Positive placement can also be going back to school or being involved in the military. We do have some that were unknown what the students did upon graduation, but I think this is a great statistic. So we have about 96% positive placement rate. The CPRC oversees, the accreditation of all the programs, and so we've had just a few. We've been on hold for quite a while due to COVID, so site visits have been rare. We were able to do one site visit this last summer, and we have yet to meet and recommend their accreditation status moving forward, but that will be done very soon. We also have a few that are under self-study review and trying to determine the best way to move forward with, either an on-site or virtual site visit. And then we have one who's been invited for their self-study. So those things we're trying to move those forward. The CPRC was involved in some webinars that I hope you guys had the chance to listen to or participate live in. And so I presented on what the CPRC is and what we do. And Sean McNair presented on the C.E.L.L. So you'll be hearing from him here in a little bit. And probably the biggest thing on the CPRC's plate this year is reviewing the standards and guidelines. And so the committee has to do this periodically. So we have to review the standards and guidelines and make sure that we are meeting the demands of the current practice trends and try to figure out how to match our educational standards for entry-level practice with what's going on in the field. And so every so often we need to make adjustments to those. And I think you guys are all aware that the move is to a master's degree, because we have been adding over the last few years several new entry-level competencies. And really, a lot of people believe that before we did this, the cytology programs were kind of teaching at a master's level degree. And now we're just sort of playing catch up. And so the things that are going on out in the field, we're trying to incorporate into these new standards and guidelines. And that means, we can only pack so much into the curriculum, into a bachelor's or a post-baccalaureate certificate. So we're trying to move to a master's degree. So where are we in the process of that? Well, we've had many kind of back and forth with the new ELCs with our sponsors and trying to adjust the wording appropriately so that everyone can agree on that. And the last round, we gathered responses from our sponsors, and based on what they suggested, we responded back to them on October 5th. And so since then, we have received approval for the ELCs from the ASCP, the ASC, and the ASCT. Now, the ASCP was just a verbal. We have yet to receive that in writing. And the CAP had just two concerns, but otherwise they were very supportive. And so I think our sponsors are in support of moving to the master's degree, and it's just a matter of readjusting some of the wording within the entry-level competencies to make sure that everyone can stay in agreement with that. And so now that we've received the feedback, we're going to be scheduling individual meetings with our sponsors to address some of their comments and concerns. We're hoping to do this sooner rather than later. And so I thought for the purposes of this, we haven't really changed anything from the last time we've met, actually from the last several times. It's just tweaking some of the wording. So I thought I would just highlight a few of the competencies that maybe have had questions, comments, or suggestions on those. And so here we see, this is a change that I know you're aware of, but the program director qualifications. So we're asking for a master's degree, and in previous versions, the SCT certification, it was either master's and or SCT. But we don't feel like the SCT certification is equivalent to a master's degree. So we're not going to say that somebody can come in with only an SCT, that they have to have that master's degree. And that will be new program directors. So anybody who's a program director now can remain in place until you are replaced. And then upon replacement, that new person would then have to have a master's degree. So there are several places where some of the sponsors had suggested adding under the supervision of a pathologist. And so I want to make you aware of the fact that we're not sure what that means from a KHEP standards kind of viewpoint. Will that mean that the pathologist involved has to have direct supervision over everything within that competency? And then will we need to demonstrate as programs how this competency is met, how those pathologists directly supervise, and will we need to show that, document that? And kind of the CPRC's viewpoint on that under the supervision of a pathologist statement is that these entry-level competencies are really written for students in an educational setting. They have to have supervision. They can't do anything by themselves. They're not signing out any cases. They're not attending procedures on their own. So really and truly, is that a necessary statement? Or should a statement be added at the very beginning of the document to say that, these are educational standards written for students? It should be implied because they are educational standards for our programs. But I think that our sponsors kind of want that statement in many of the entry-level competencies. So that's something that I think I would like to hear your comments on, especially the educators. If we leave this in, and if we have to show or demonstrate how we've met this competency, would your program be able to demonstrate that your pathologists are having direct supervision over some of these, competencies? Another one is that the student, so this one, I can just read it briefly, but the student will demonstrate the ability to perform, and this is rows, but for cytologists, it's important that we don't use evaluation, we're using assessment. So instead of rows with an E, it's rows with an A, of FNA specimens, including touch preps, and clearly communicate results of this assessment under the supervision of a pathologist. So there's that under supervision of pathologist. The student will understand the principles of patient safety, including informed consent and timeout and will demonstrate competence in the following. So we have slide preparation and staining and communication and labeling and patient identification and recording requirements for adequacy assessments, specimen triage. And so this was the suggested proposed new wording. Under the supervision of a pathologist, the student will perform rows of FNA specimens of cases, including touch preps, and clearly communicate the results of this assessment. So this is just one thing that we haven't really discussed as a group yet. This is the latest feedback we've gotten. So as the CPRC, we'll have to get together, discuss it, and then we'll be discussing that with our sponsors as well. But it might be nice to hear from you what you think of the old versus the newly proposed wording. This is another one, and this is the student will demonstrate the ability to describe. And so the CPRC has removed perform. So it used to be demonstrate the ability to perform the process of gross examination of small biopsy specimens. So this one has been discussed, and this is how it will likely be moving forward, is the ability to describe. So hands-on training may not be necessary in the gross room. Here's another one. The student will demonstrate the ability to utilize clinical digital cytology or pathology to assist the pathologist as part of a healthcare team, including but not limited to rapid on-site assessment, intraoperative consultation, and second opinion consultation. So the sponsors have proposed new wording, and that would be the student will utilize digital cytology in educational settings to simulate clinical use in rapid on-site adequacy assessment.
Join the meeting.
And so again, I would like your comments on the current wording versus the newly proposed wording. I think it's intuitive that it's in an educational setting. It's under the direction of somebody else overseeing the educational process. And they may in fact be doing digital cytology in the clinics with a cytotech or a pathologist, doing these things and not necessarily in simulation type exercises. So just thinking about that moving forward and how would that impact what we do as educators and how we demonstrate to for accreditation purposes. And this one just had some comments about it, and that was the student will demonstrate the ability to indicate areas with adequate morphologic material suitable for companion testing on cytology slides or tissue blocks. And so some of the questions revolved around, is this a pre-screening only because it's a physician-only service, and didn't think that we should include this as an entry-level competency. But in speaking with some of the other program directors and people in the clinics, saying that they already do this, and most of the time it's after a case has been signed out and you're doing it for additional ancillary testing, that it's not a physician-only service, that a cytologist would be able to do that. And so just seeing what your thoughts are on that. And then the name change. So I'm not sure that all of you have heard, but recently the American Society for Clinical Pathology on October 30th, their Board of Certification, Board of Governors, voted to approve cytologist and specialist in cytology, and they are taking the technologist out of the word, out of the title. And so this is something that we have been trying to address in the master's level standards and guidelines. We would like to put forth a name to go with these new, this new level of education. And, a lot of people see a technologist as a lower level, practitioner than somebody who would not have the technologist name. So we've done some surveys and things. I'll show you the results. But as of now, anybody who sets for the Board of Certification exam, their certificate will say cytologist or cytology and not cytotechnology. So the CPRC conducted a couple of surveys, and this one is to the educators. So a lot of you here on the call today. So we had some medical directors, program directors, education coordinators, instructors, and we had some students. And so the overall vote was 38% voted for cytology, cytologist, and that was the highest by any number here, but we also gave some other choices. And so just to point out that that one came on top of that particular survey. And then we asked the ASCP to send out a survey to practicing cytotechs and specialists in cytology to ask them their thoughts about the name change. And so they sent it out to roughly 6,700 practicing cytologists, and we had 861 complete the survey. So here you'll see again, cytology, cytologist came out on top at 48%. And if we looked at all of these and took into account, who wanted change and who didn't. 84% voted for some sort of change, whether it was cytology cytologist or cytology practitioner or whatever the other choices were, versus sticking with the cytotechnologist name at 16%. So some of the things that we're working on now is to develop a best practice guide, a frequently asked questions, and these are all related to the standards and guidelines that we're putting forth. And then a plan to transition programs to a master's level. And that plan will have a transition period of 3 to 4 years put into place so that all programs have time to plan and make that transition. And then to discuss with the ASCP Board of Certification strategies for their new certification exam, and then help C.E.L.L. compile some resources for their new website. And so here is the new timeline. You can see I've taken the old timeline and just scratched it out and put a new year on it. And so we're about a year behind, which really means we're probably about 3 years behind, because every year we gain a year. And so we really need to try to stick with the timeline. And so just to let you know that we're going to try the best that we can to kind of adhere to the guideline, the timeline, and to get some of these changes approved this year. So with that, I think we're going to move on to the next presentation and have questions at the end. And so I'm going to invite Sean McNair to present his presentation on the C.E.L.L.
Hello, everybody. All right, perfect. Get my video on. Okay. Hey, everyone. How's everyone doing? So the C.E.L.L. website has been quite a journey. What I will do is I'll start with showing the video, which was the website preview for the C.E.L.L., and then just have a brief overview of kind of the thought process behind the building of the site. So I will share my screen, and I'll take it from there. This was also aired at the ASC meeting.
Hello, welcome to the preview of the Cytology Education Learning Lab website. I am Sean McNair, the chair of the subcommittee. So this presentation is going to be very brief. However, I wanted everyone to see the new refreshed interface of the C.E.L.L. website with a fresh new homepage and the organization of the website being completely updated. This website was reimagined using a template which focused on user experience and not just prioritizing content. Our affiliates are represented on the bottom. There are numerous areas for users to interact with the website with a customizable search bar where they're able to search for topics at their desire. However, the most important part of the website is actually the courses as well as the gallery. The material represented in the entry-level competencies for the cytopathology professional is an extension of the KHEP guidelines and standards for the cytology professional. Those guidelines were utilized in developing the format of this website. The 6 main competencies of the cytology professional are represented on this page. As you see, when you open the course catalog, you will be taken to a course. The courses will have course descriptions, letting the learner know what they may intend to see while taking this course. And the courses are subdivided into specific topics. This particular course is basically born from the Bethesda manual for cervical cytology. And you will be able to see that it's subdivided into 5 different courses, along with an individual gallery, as well as resources that will be available for the user. Most importantly, this website will truly serve its purpose of being a reference site, as users will be able to view pages with interactive multimedia content, including videos and images, as well as key text points for the user to understand. Here's the example of this specimen adequacy page. And you will also, the user will also be able to access any part of that lesson plan on the left sidebar, along with the additional resources. As you can see here, we've embedded a video which discusses the topic of cervical specimen adequacy. Important key point of this website is that the user experience will be embedded within the site itself. We will not be linking out to other websites, and we would like to have this website serve as a home for some of the most interactive and informative educational content created by cytology professionals today. We have an FAQ page which answers general questions regarding the website right now, particularly registration fees, which there are none, who's responsible for the content, what are the lengths of the course, is there going to be a certificate? The goal of this website is to be the point of reference for today's cytology professional, and I'm excited to have brought you a brief preview, and I look forward to the next iterations of this website in the coming months. Thank you.
All righty, so I'm here. So this this past year, post approval for the C.E.L.L. website has definitely been a very difficult year in terms of trying to keep focus with this. But I do believe that there are some of the biggest challenges with creating something like this is that creating any website really isn't about what we are as content experts or what we can find. Essentially, creating a good website is really about creating a good website, which is actually is not a skill which I was blessed with coming into being the chair of the committee. But I did understand as a user what attracted me to some of the content that I like to consume regularly, as someone who really appreciates that. So I generally just basically did lots of research and honestly worked with the developers to say, how could we stay focused with, trying to build an experience? So everything that is seen on the C.E.L.L. website, actually will go back to the screenshot. Excuse me. I'm just going to screen share really quickly. So everything that is seen in this website is basically something that has been thought of as a way to enhance the user experience. So the first thing that we did is we used a learning management system template. It took me probably a month or so to find the right template. However, the most important thing with the learning management system is that it allows you to present all of the courses in a very organized manner. I think the amount of content that we have available to be able to disperse on the website is voluminous, but I think that organization is a huge issue. And as someone who wants to use and interact with the website, the usual biggest problem we have is that the stuff is there, but we either can't find it, it's either too hard to find, or the website isn't really easy to navigate. So once again, those are things that, my experience as a cytotechnologist really won't be able to help. So I decided, we decided that we would start by using the entry-level competencies so that educators and professionals alike could be able to find the appropriate section. From there, we have our descriptions of our courses, which just was all kind of homegrown, just kind of working with the team to describe the courses and to set up an organization of content. Then this is the, of course, alpha form of the website. So of course, having that customizable search bar was extremely important. We will require registration in order to see all of the courses. So we want to make sure we, encourage people to register for the site when it becomes available, and we will keep it constantly updated. We, have our about page in which we will, we will display our faculty as well. We have a mission statement now, which is to provide relevant, up-to-date, and high-quality educational reference material to cytology professionals, including program directors, practicing cytotechnologists, and current cytology students, practicing cytopathologists, cytopathology fellows, and pathology residents. So we are, this is stage one, but I think the most important part here was to, kind of discuss what to have a very welcoming and inviting homepage that really makes the user want to say, hey, I'd like to really look through this page. And then once they get to their landed destination, we have some really, really nice content for them to preview. So the idea here is that simple is best. And I've resisted the urge to really get distracted with trying to hit a home run when it's really, really important to just kind of present this website as a cohesive experience, which takes a lot of thought and the urge to just, just resist distractions, which can kind of throw us off course. So simple is hard, but I think after 1 year, I can say that we have definitely made huge strides in getting this material together. So I'm very excited about what the next few months hold. And, we'll be expanding FAQs, we'll be adding image gallery, and we'll have a message board for feedback. So I think that's all that I have for the C.E.L.L. website as of now.
Great, thanks, Sean. So I guess at this time, we can open it up for any questions about either topic.
Amber, could we just go back? I know you wanted some feedback on maybe 2 or 3 things in your presentation. Just wanted to refresh my mind on what the wording was and the standards that you had the questions about.
Sorry, I closed my presentation, so I'm trying to get it back up. So
no
give
worries.
me just a second.
No worries.
While Amber is looking, this is Chuck. Chuck Sturgis. I'm coming from Mayo, and I have the pleasure of kind of serving as the vice chair for the committee. It's really been my pleasure working with Amber, the committee, Sean, everyone involved. And it's an astronomical amount of time from the perspective of the 877, that's 4 and 1 are donating to kind of bring cytology to the best place for the future. So if you encounter them, give them a pat on the back for everything that they're doing. Go ahead, Amber, sorry.
It's okay, thanks for that. It is a lot of work, but we have a team, and so we couldn't do it without everybody. So this was the first one that I showed, and so this one, the main part is this one is shortened, and I'm not sure the intent. So this one is going to need to be a conversation with the sponsor, because this part was left out. So I don't know if that's the intent of not having this part, and then this part was reworded. And so I think here it was shortened to say, under the supervision of a pathologist, the student will perform rows of FNA specimens of cases and clearly communicate results of this assessment. And so basically they rearranged it. I'm not sure about the bullet points again, but to clarify that the pathologist supervision is over all phases of the process. And if we're going to discuss that, I think that one should be probably the #1 discussion is, it's randomly placed. A lot of the things are under the supervision of a pathologist, and it seems to be more when we're talking about a clinical skill, and when a cytologist who would be out in the clinic working, not a student, would be performing these things, they're going to be under the supervision of a pathologist. But a student is really under the supervision of either an educator, a practicing cytologist, or a pathologist. It kind of depends on the situation. And so if we have to make this in everything for these pieces to say under the supervision of a pathologist, what do some of the educators think about that wording?
I have one question about this, Amber. So here, we're talking about an outcome, right? We're talking about a competency that a student should have at graduation, right? We're not talking about a process, right?
Right. So
yeah.
by the end of the program, the student would be able to perform F&A and clearly communicate, perform rows and clearly communicate the results.
Yeah. My thought process is that as this is an outcome and not a process, I think we're saying that the student has to have this ability, and that under the supervision of a pathologist, I'm not sure what role that plays in an outcome. I'm not sure, honestly. Yeah, because like you said, is a student being supervised by a pathologist, but that's process when we're talking outcomes here. That very well could happen, but I'm not sure why that would need to be in this particular standard or guideline.
Amber, it's Kalyani. I thought I might be able to just add the KHEP perspective. You had mentioned that you weren't certain at the beginning of this part of the presentation, you weren't certain exactly what KHEP's perspective would be on the literal expectation of adding something like under the pathologist supervision. So I can't say definitively, of course, this document, once it's been finalized as far as the CPRC and sponsors go, will be reviewed by the standards committee of the KHEP, under KHEP. From my experiences in the past, looking at other standards that have gone through, when this language comes forward, to me, it says that the student will have to be under the supervision. These are competencies expected of the student upon graduation, not the practicing cytotechnologist or cytologist rather, sorry. And I think that KHEP does try, the standards committee does try to communicate that the focus here is students, not even graduates. It's the student, because the program doesn't have any influence over graduates. Once they leave their program, you have no control, if you will, of what graduates will be doing or not doing. And so I don't know if that, for the group that may not be as familiar with the thinking of KHEP Standards Committee, I just wanted to throw that out there, that my guess is that the Standards Committee will ask about this and how programs would demonstrate this then, that the pathologist is present, and so how does the pathologist provide the supervision for the student? Thank you.
Thanks, Kalyani. So any questions about that or comments?
Amber, this is Chuck. I would just chime in that, as a supervising pathologist, there are many instances where, like, I might be involved in going on a procedure which could be either real time or virtual, depending on whether one is in the room or using telecytology, where the technologist is acting independently and is teaching the student of cytology independently, and I'm not there. And so it would be impractical and I think misleading to imply that the pathologist is always there holding the student's hand, or that the student can't function without the pathologist being, literally in the room. It would be impossible to document as well. So I think, if we had an overall statement somewhere in our documents that says, we realize that cytologists are functioning under the guidance of physicians in all settings in a way, then we could remove these little random bits that could in a way be rate limiting or could cause trouble as we're trying to accredit schools and optimize programs.
So I did get a question in the chat earlier that would I provide these questions and the ELCs and the proposed language to the program directors or the instructors and everybody at the at different programs. And I think that that's important. I think we should get these out and get some thoughts in before we meet with our sponsors to sort of gather some feedback on the wording. And so I will do that. So we don't have to sit and hash this out today, but if anybody has some thoughts, I would like to hear them, now as we're going through this, but you will get the opportunity to comment. So don't feel like if you can't get your, thoughts in today or need time to think about it and process it, then, that's perfectly fine. So
there's a question there from Sana.
Okay.
Yes, thank you. I just want to say one thing. My understanding is that every program has a medical director, and any, the activities within the school are basically supervised and agreed upon by the medical director of that program. This here in no way says under the immediate, there were certain different levels of supervision. So it does not say under the immediate supervision of the pathologist, which would require that pathologist to be present at each step of the process. So I don't think that it is the wording is as restrictive as what some people are reading into this. That's my personal opinion.
So Sana, you bring up.
Sorry, if I may say, it's similar to how we train residents in pathology. And there are different definitions of supervision, and sometimes at the side of the resident, and sometimes it's supervision of the activity and agreement on how things should be done. And I believe that this is meant to reflect practice and not, I understand that these are students and they're not in practice. But some of the wording is to reflect every day's practice as well.
So I think you bring up a good point about the medical director, but the schools, there are the qualifications and the responsibilities of the program director and medical director listed in the standards and guidelines. So yes, they're overseeing the curriculum and making sure that what the programs are doing are meeting the needs and the outcomes. And so that's already sort of written into that. And I really feel like the way this is written, and this is my opinion, so we can go offline and discuss this, and of course we will be discussing with the sponsoring organizations. But I think that the way this is written really does reflect clinical practice. And you're saying that a cytologist can't go out and do this without the supervision of a pathologist, which yes, you're right. Well, and not in every, a lot of cytologists will go out and perform rows and a pathologist will never come, but they're still under the supervision because the pathologist, the medical director of the lab oversees everything. But I think that those are two different things, and we don't need to mix them in this document that's purely reflective of educational processes. And so I think we need to really separate those two things. We're not asking for changing of billing codes. We're not doing anything with billing the patient. We're really doing education. And so I think that's completely different than practice standards. So anyway, keep that in mind. I think we should probably move on to the next one, which this one doesn't really, I wouldn't mind hearing comments about, but it doesn't really need a ton of discussion. But how does this help programs? I think this will only help programs in the long run, so that we're not asking students to perform gross examination, but we're asking them to be able to describe gross examination of small biopsy. So I think a lot of programs were having trouble wrapping their head around how do we get them in the gross room? How do we get hands-on experience? So I think this will only benefit the program. So I don't know if anybody has any comments about that one. All right, well, hearing none, we'll move on then. And so the next one was this digital one, which I think is kind of similar to the one that we discussed earlier, which is where really the suggestion is, utilizing digital cytology in educational settings to simulate clinical use. Well, okay, we can do that, but I think we also ask our students to go in when possible to do things in a non-simulated situation. We may be asking them to prepare under the direction of a cytologist or a pathologist how to do this digital cytology, like telecytology for a rose. And so I think that this is very limiting. And this again, the first one is really to say these are educational standards that our students need to be able to do, to perform. And of course, they're going to be under the direction of somebody. They may or may not be simulated. They may or may not be live cases. But we need our students to do those things, and that would be under the purview of the program. This one really says they can only do simulated cases. And so I don't know if we need, if people have thoughts about this one.
Amber, there's a question from Caitlin Sundling, or a comment from Caitlin.
Sure.
Caitlin, were you wanting to chime in?
Oh, actually, I'd raised my hand back when we were talking about the ROSE standard, but it's somewhat relevant here. And I think one of the solutions that had been proposed in previous discussions was focusing more on the possibility that simulation could meet some of these standards. And that if the standards were worded in such a way that it's clear simulation can meet those standards, then you can easily exceed those standards by using these methods in clinical use. The other thing that I wanted to suggest, and just in the role of pathologist involvement, it is really important that students get feedback from pathologists in cases that they're directly involved in. So that's one thing that I actually really like about encouraging more pathologist involvement, is that even though they may be very directly supervised by a cytotechnologist, and certainly the direct supervision, it's not reasonable that a pathologist is there every single case. It depends on your clinical practice. That completing that loop of feedback on the final diagnosis and the pathologist's interaction in that case would be really educational and helpful.
Bert, can I comment in that digital? So we need to, I do a lot of telecytology, and we teach digital in our training to the cytologists, and they need to learn how to use that telecytology. They need to be familiar with the technology, and so that's part of the training, because then when they are applying for a job, they may need to use telecytology. So they need to learn how to use telecytology.
I think
we are
that,
doing that.
I think another concern, which is a relatively valid concern, is that in any area where we place, I think this was mentioning the other comment, they're under direct supervision. I think we're all, the biggest worry is how do you demonstrate to, the CPRC and KHEP that these things are under supervision. There's the other half of obviously introducing that language to medical directors. I'm just thinking of my own, would probably be terrifying because they are happy with obviously indirect hands-off supervision or, a hands-off leadership and advice, but they, we just have to clarify what that means, because I think overburdening our medical directors would be a very, it would be a very dangerous thing, as this is from someone who has already had a change in medical directors. And I'm pretty sure because, part of it was we're all obviously overwhelmed with work, and the medical director, this is not their only responsibility. So I think we have to be very careful about the downstream, which is showing that supervision, as well as, medical directors, feeling that they may have to have too much time devoted to hands-on oversight of things that I think we can handle.
So there's quite a few comments in the chat, and I think that let's see if I go back to the chat, trying to cover everybody's. So I'm not sure I have time to read through all of these.
Amber, I'm so sorry. The first one was about the C.E.L.L. website. Someone said that they found previous PowerPoint and PDF lectures were useful as a teaching source, and they asked if those will be available again. We'll definitely be adding new updated resources, some of which already exist, and we're trying to collate resources. But we are trying to stay away from PowerPoints and PDF lectures. We may add those as additional resources. So stay tuned, and we'll just see how the website looks as we flesh it out.
Good. So there's comments about, of course, the medical director or the pathologist supervision. And so not all programs would have access to pathologist supervision for all aspects. And then some say, the objectives would be met during the practicum course for students. I think what really needs to happen is to think through the idea that the medical director is overseeing everything in the program, and that's already been kind of a blanket statement. So I'm not sure it needs to be reiterated in each ELC, because they have to oversee it anyway and check off on things. And if we add it in each statement or in various statements, not all statements, then that's what's really going to prompt the standards committee to look at that and say, well, why is it being asked here but not here? And the medical director is overseeing it. So possibly we need to find a way to document this, and how are you going to prove the medical director involvement with these particular ones that are being pointed out specifically. So I think that's sort of where the conversation needs to go, is how do we clarify that? Because I think that everything the student does is being overseen by the medical director anyway. So Michelle Smith says simulation can be part of the standard, but shouldn't limit the standard. I agree. And so maybe we should revisit rewording that standard altogether. Do all programs currently use digital cytology? I don't think in that standard, if we reword it, then it could be simulation or live or both or whatever combination thereof. And so I don't think you would have to, but I would have to say that the vision of digital cytology is left sort of vague. There's no definition of what that is. So it could be anything from, camera to live telecytology to a system that, uses the what do you call it, the stage, you know, we're at self-directing stage and there's all kinds of things. And so it doesn't really hone in on the specifics. It sort of leaves it vague to say, you know, you have to have an understanding. You have to demonstrate the ability to utilize some part of digital cytology, pathology as the healthcare team. And so I think that that's kind of left vague on purpose. All right, so it looks like we only have about 4 more minutes. And so Dr. Sundling brings up the fact that standards are minimum requirements. Clinical practice use would exceed the use of simulation only, and this could be clarified. And, you know, I think that that's true, but I do think we need to make sure that what we're asking to do is what we want as minimal and not, I think that something to think through with a couple of these. But I think the good news for all of this is there's only a few points of discussion. And so everything else has been approved. And I think we've made we've made some progress along the way, even though it's taken us 25 years or so to get here today. But I think that we can solve some of these things hopefully fairly quickly, you know, within this next year and move things along. I think we can all try to agree on some wording that best suits and meets the needs of everybody involved. And that's what we're hoping to do moving forward, meeting with the sponsors. Any last comments or questions about name change? Anything on those ends?
We're almost there. That's almost there. That's it.
Almost there. We've been almost there for a long time. So let's hope we get there.
Yes.
But so educators look for, you know, emails regarding some of these questions, and we can have a discussion about that via email or survey, some sort of something back and forth about how you feel about some of these new entry-level competencies. Somebody just asked, when do we start marketing using the name change with the new ELCs? Well, we're not even sure we're going to make the name change in the ELCs because that has not been approved by the sponsors as of yet. But it has been approved with the ASCP. So anybody who is sitting for the new exam, or not the new exam, but the exam with the new name, that's what they're going to be called. And I think you can use the name. You can use the name now. You can start using it. And I think at the ASC meeting, they used the name cytologist instead of cytotechnologist at the annual meeting. So Barb Frayne says ASCP is a change in credentialing exam only. And so she's right. And so the certificate will say cytologist. I think if you ask Dr. Holliday, he would say whatever's on the certificate is what people are going to want to be called. That's, you know, one opinion. Schools and programs are another, you know, thing. And so our schools are now accredited in cytotechnology. And so until we can get that name changed for us, then there will be two different names floating out there, all meaning the same thing. So any other questions or comments? For state licensure, is there a process for changing the name? So I'm not sure about that. I can let people who sit in states with licensure answer that. But what I have heard from multiple states and people who sit on their state licensing boards is that they don't really see an issue. There's not going to be any problems with that. And so I don't know, Sean or anybody else who's on who actually lives in a state with a license. What are your thoughts?
I would say that it really shouldn't present an issue as long as the standards that we put forth are reflective of their, you know, educational standards for licensure. Yeah, particularly because we're not really discussing scope of practice here. This is strictly educational. So.
All right, well, with that, I'm sorry we couldn't get to all the questions. It's 12 o'clock. I do have another meeting I have to lead, so I'm going to have to go. So that means all of us are probably going to have to go. But, you know, if you have any questions, comments, anything, please feel free to reach out to anybody in the CPRC. And like I said, as educators, wait to see some emails about gathering some comments from you. And we look forward to your involvement moving forward. Thank you guys for being here today.
Thank you, everybody.